What is overactive bladder, OAB, and bladder irritation? Imagine feeling a sudden, urgent need to go to the bathroom that you just can't ignore. That's often what people with overactive bladder experience. Overactive bladder is a collection of symptoms involving a strong, often uncontrollable urge to urinate. It can happen during the day or night and may include frequent trips to the bathroom, sometimes more than 8 times in a 24-hour period. Some people also experience leakage of urine, known as urge incontinence, when the bladder contracts suddenly. It's important to understand that overactive bladder is not a disease by itself, but a set of symptoms indicating that the bladder isn't functioning normally. Bladder irritation is another common issue that can cause discomfort and abnormal sensations in the bladder. It refers to inflammation or stimuli that make the bladder feel sore or sensitive. This irritation can lead to symptoms like urgency and frequent urination, similar to those seen in overactive bladder. Both conditions can significantly affect daily life, making simple tasks like working or sleeping more difficult. The causes of overactive bladder and bladder irritation are varied. Sometimes, they happen because of infections in the urinary tract that inflame the bladder lining. Other times, nerve signals between the bladder and brain may be disrupted due to neurological conditions such as stroke or multiple sclerosis. Overactivity of the bladder muscles, called detrusor overactivity, can also play a role, where the muscles contract involuntarily or send false signals of fullness. Bladder stones or even bladder cancer can cause irritation and symptoms similar to overactive bladder. Certain medications, caffeine, and alcohol can irritate the bladder or increase urine production, making symptoms worse. Structural issues like an enlarged prostate in men or bladder obstruction can also contribute. Additionally, systemic conditions like diabetes may affect bladder function over time. The underlying mechanisms involve complex interactions between nerves, muscles, and the brain. In overactive bladder, the bladder may contract too early or involuntarily, leading to sudden urges and frequent trips to the bathroom. This can be explained by theories involving nerve signaling abnormalities, muscle overactivity, or heightened sensitivity of bladder nerves. It's crucial to recognize that symptoms of bladder irritation and overactive bladder can sometimes be caused or worsened by more serious conditions like bladder cancer. That's why persistent or worsening symptoms should always be evaluated by a healthcare professional. They can perform tests to rule out underlying issues and determine the most appropriate treatment. Management strategies include behavioral changes such as bladder training, pelvic floor exercises, and fluid management. Medications can help by relaxing the bladder muscles or calming nerve signals. If an infection or bladder stone is present, treating the underlying cause can improve symptoms. In more resistant cases, advanced therapies like nerve stimulation or surgery may be considered. Early diagnosis and proper treatment are key to improving quality of life, preventing complications, and maintaining bladder health. If you experience symptoms like sudden urges, frequent urination, or discomfort, it's important to seek medical advice. Remember, each person's situation is unique, and a healthcare professional can provide personalized guidance based on your specific needs. In summary, overactive bladder involves a sudden, strong urge to urinate along with frequent trips to the bathroom, often with leakage. Bladder irritation refers to inflammation or stimuli, causing discomfort and abnormal sensations. Both conditions are common but requiring careful evaluation to identify underlying causes and ensure effective treatment. Always consult a healthcare provider for a proper diagnosis and tailored care plan to support your bladder health.